So now I'm going to introduce our next guest. This is Michelle Ottersbach. Michelle has more than 20 years of experience in early detection, prevention, and management of lung cancer and other chronic diseases. She's a clinical nurse leader and advanced degree registered clinical exercise physiologist and RN with a passion to optimize patient outcomes through patient advocacy and enhanced access to multidisciplinary healthcare teams from bedside to community. Michelle is an adjunct professor, speaker, volunteer, and member of many key communities concerning cancer. And one of the things I like about Michelle is that she's a rebel rouser, like myself, but in a good way. So we like to push the envelope, don't we, Michelle? So come on up, Michelle, and we've got the podium there and then a handheld microphone, whatever you prefer. You want the handheld?
Okay. Hi, my name's Michelle. I found my passion in exercise physiology. That's where I became passionate in improving the patient experience throughout the continuum of care. When I started in exercise physiology, it was dangerous to exercise someone diagnosed with cancer. They said, don't exercise. And that was in the 90s and 2000s. And so then we had, if anybody here is from St. Louis, in 2009, the American College of Sports Medicine met in a round table to develop the very first cancer exercise guidelines for cancer survivors, which was published in 2010. And the key with those guidelines was to avoid physical inactivity and become more and ways to incorporate movement throughout the continuum of care, before treatment, during treatment, and after. And what's key before starting an exercise program, I'll give you some exercises, but always talk to your oncologist prior to starting an exercise program. And keep them updated on what you're doing. So if you're anemic, there's some things you can't, you should kind of withhold from exercise. Just talk to the doctor if you're anemic. If your white blood cell counts are high, if your bone density or bone mets, just kind of talk to the doctor. Some cancer centers have a cancer exercise physiologist. They also have physical therapists, so there's physical therapy in all the healthcare systems. So always talk to your medical oncologist and give them an update. When you do start exercising, just think, start low, go slow, and always, and when you complete your exercise, always feel like you can do an extra 10 to 15 minutes. Because when people are diagnosed with exercise, when they're diagnosed with cancer, it's like our perceived exertion changes. So when I have been training people who were diagnosed with cancer, whether you went through chemo or just surgery, it didn't matter. When I was training them compared to another population, people who were diagnosed with cancer always rated things at the same relative intensity easier than my athletes or my heart patients, all of them. So you just want to go by how you feel, and each day it's going to be different. So on the days you feel fatigued, don't exercise that day. You just kind of be more active and moving around. You can just, and so some simple exercises. Well, if you feel pain, stop. Don't do it. Pain, doesn't matter what you're diagnosed with. It doesn't matter if you're a human being and you're exercising and you feel pain, stop. It just means don't do that. So when you go to the doctor and says, it hurts when I do this, they said, well, then don't do that, right? So just listen to your body and do it to feel healthy. A lot of people do quit their exercise program because they try to do too much, too fast, too quick. So it's a journey, it's a marathon. And so you just take some days are going to be good and bad, and you do what you can do. And even if you can't stand up, there's simple things like a stretch. So you can kind of pull your fingers back and you can feel this, and just enough to feel the stretch, and make sure you're breathing. If you can't talk, if you cannot talk, it's too hard. You have to be able to hold a conversation. You know, you just hold it, and sometimes, you know, hey, if you lose count, you lose count. You just stop and then go to the other side, you know. And if anybody's been to PT and you lose count, they usually say do another 10. So we as exercise physiologists and PTs, we don't know how to count. We'll count for you 1, 12, 3, 2. So I mean, you just go, and you just can kind of, that's just something simple, you know. And then if people have shoulder problems, it's going to be harder to raise them up. Stay low. You can still do this staying low. So you can stay low like this. Sorry. You can stay low. So the higher up you, and then some more exercise that you could do is just, you can just heel raises. You can just do those, but make sure you're holding on to something. Yeah, hold on to something, and you just do some toe raises. Even if you're in at a store waiting in line with your cart, just do some toe raises. Or you can also, like, even in a store in your cart or next to your chair, you can just kind of, these are hamstring curls. If you go slow enough, it gets harder. You never need weights. So you can either get heavy weight, which you have to go really fast to do it, and you're not going to, but if you go slow enough, you will feel it, and you'll never need a weight. So you can just go slower, and you're just like, oh, there's nothing. Just keep going slow. You'll feel the hamstrings. You know, you can just do those, just getting the movement. Even if you're sitting in your chair like right now, you can just kick your, kick your legs out. I mean, you can just do that. If someone's going through chemo and you're in your chemo chair, I mean, you can just do these, you know, or you can just sitting in a chair, you can march, you know. You can also dance, you know, you can cha-cha, whatever. So, and then, so you could just do some light dance. Just make sure that you're talking. And if you're new to exercise, try to start and limit your time to no more than 10 minutes the first day. Some people start to feel better. As they start exercising, the endorphins get kicked in. They start feeling better, and they want to do more. And then the next day, they're wiped out. Don't exceed 10 minutes, even if you're feeling excellent and you think you can do another mile. Just stop. You may even do 2 minutes and just stop, you know, and just see how your body responds the next day. Because we don't want you to feel wiped out for the next 2 to 3 days. It takes a little bit longer to recover, but just stay low, start slow, start with 2 minutes, no more than 10, and just see how you feel. And just realize you may be able to do 10 minutes one week, but you may have to go to 2 minutes the next. You know, just how you feel. The thing is, you just want to move, you know, and just keep it. I forgot. And then another exercise. I think everyone has exercised today, because I see you in positions. Everyone has done a squat, because if you didn't do squats, how did you get in the positions you're at now? And so you just sit down in a chair, stand up, but make sure you hold on to something. So you already did your one exercise a day. And so, I think I'm running out of time. Oh gosh, I just went blank. I'm sorry. Does anyone have any questions? Or one last thing, one exercise you can do even in your doctor's office is spell the alphabet with your foot. It's a great exercise even for runners. And you can even do it here, and you just spell the A, B, C, D, E, all the way to Z. And then you do it with your other foot, which gets kind of interesting, because you're like, am I ambidextrous? And then some people say, well, do I do capitals or lowercase? Well, both, cursive, print, and you could do those.
That's a great exercise to do on the plane too. When you're going home, you can do that, and it's good for your keep it from getting a blood clot from sitting.
Yeah. And I think I exceeded my time. Did I?
Oh no, you're good. Yeah, you're good. Any comments or questions? Yes, Katie.
So people who have cancer or chronic disease, is there, I mean, I assume they need to check with their doctors before they begin exercise? Or is this a form of physical therapy that you ask your doctor about?
Yes. Chronic disease, anyone with any type of chronic disease or cancer, it's always recommended to talk to your doctor first for anything, just to get medical clearance. For certain, like if for lung cancer, there's pulmonary rehab. And you can get referral for that, and insurance does cover pulmonary rehab. If someone has heart disease, you have cardiac rehab, so they can find a diagnosis to get you into a medically supervised program if your hospital doesn't have one. So you have pulmonary rehab, you know, and then there's cardiac. There's cancer physical therapists. They can, your insurance can cover physical therapists, and they can work with your insurance. They'll do an assessment, look at your strengths, give you an evaluation and a plan. So it's an evaluate and treat. So if your doctor can always talk to your doctor, they need to put in a referral for physical therapy, do an evaluate and treat, then that allows that physical therapist to assess and evaluate you, and in order to develop a plan, and they can structure your PT visits so you don't burn them all up in 1 year. So some people are limited on PT visits, so they could work with you there. The American College of Sports Medicine, they do set the national guidelines for exercise and all chronic diseases and cancer, and it's 150 minutes a week, so 30 minutes a day, 5 days a week. Now, start low, go slow. You may be going you can do, it doesn't all have to be at once. So 30 minutes a day could be 2 minutes, or 15 times a day. It could be 15 minutes twice a day. It's better to exercise. It's like eating like smaller, more frequent meals. Exercise is the same way. More frequent movement throughout the day, because we do have people even that out there in public. They're like, I don't know why I'm overweight. I exercise for an hour every night, but then what do you do the rest of the day? I sit at a desk and don't move. It's best to do physical activity like you eat, more frequent, smaller meals, and then exercise more frequent, smaller periods of time. You know, and then as you feel comfortable, you'll be able to gauge on what you can do. And the goal is to be able to exercise in a year. So we don't want you to do sprint drills. Don't keep up with Chris, because we want you may be able to do it for today. We want you to be able to continue. He came in. You want to be able to come and continue to exercise a year later. So we want you to keep going. So just kind of space it out and dose it. And just go by how you feel, not by your heart rate. Your body will tell you. If your body says stop, stop. If your knee hurts, I don't care who you are, what human being you are. If your knee hurts, don't do it. You're doing something wrong. So, and we can adapt those. So a physical therapist, exercise physiologist, some places like Cancer Support Community and all, they have fitness. They have fitness programs. So in your community, there's the cancer centers can hook you up with a cancer fitness class.
How about the Live Strong program? I've been in that, and so I've done that, and let me just mention to a couple people what that is. It's a free program. and it's at a lot of YMCAs, but it's free for the cancer patient, and they can usually bring a partner. Not only is it free you can use the entire facility for free, even if you're not a member, during the whole program. And then afterwards, at least at my gym, and I think at a lot of them, you get a reduced membership rate. So but you go at your pace. It's all customized. Again, you've got to get your doctor's permission. But yes, Maida, did you?
When I was first getting treated, I found out my insurance would pay for me to go to the Y. But just for people to check it out, I had to actually show up twice a week. Even if I didn't get on a machine that week, you had to show up twice a week in order to keep that privilege. But it was worth it. Yeah, during the pandemic, my doctor said, no, we're done.
So
Yeah,
I think we're about out of time now, but might have time for one quick question if there's any. And if not, Michelle, thank you so much. Appreciate it. Oh, do you have something? Oh, yes. Thank you.